Good afternoon, everyone, and welcome. Today we have with us Marylue Bell from Preferred Family Health. So welcome, Marylue.
Hi, thank you for having me today.
No problem. We are going to talk about a program that they have, and it's called Show Me Hope Crisis Counseling. I practiced that and I tripped over it still. So talk to me a little bit about that program.
So the state of Missouri opened up the grant in the aftermath of COVID-19 because it was declared a disaster. So what we do is we go out into the communities that we serve, and we have 23 counties that we serve, and we can talk to people and do individual or group counseling sessions, or we can just offer them resources. It's all free of charge and it's all anonymous. So it allows people to feel a little bit safer or not have to worry about any stigma or any shame with it. So it's a really great program because it allows us to really reach people where they're at. We reach out to food banks, laundromats, pretty much anywhere that, people are going, we're there.
So you go in home and do these visits?
We haven't done that yet, just because things are weird in the world right now. So what we are kind of leaning towards is doing like door hangers. And that way it allows people to initiate the contact with us and we're not intruding in their space or making them feel uncomfortable. So once they initiate the contact, if they, want us to come back and sit on their front porch and visit with them, then we'll do that.
Okay, what are some of the resources that you offer for these folks?
So like I mentioned, we do the individual counseling, we do the group counseling, but we can also do a referral service. So a lot of times when someone is needing help with mental health or substance use, they really don't know where to turn. So we can begin that process for them and say, these are the places that we have connections with. Do you want us to sit with you while you make that phone call? And if they tell us, I'm having a hard time paying my light bill, we help them find resources to pay their light bill. If they're having food insecurities, we get them in contact with food banks. And it's just, we're that little connection piece between what they're needing and how to get there. So we help to navigate that. Everything's kind of overwhelming right now. So we may think it would be simple to, Google that information, but sometimes it's just not. Just that process is very overwhelming. So to have someone there that doesn't pass any judgment and says, I got you, I can help you find that. It can really help ease some tension.
Well, and I assume it's hard during these times to navigate some of these resources because you don't know who's open, you don't know who's accepting walk-ins and things like that. So yeah, it could be very overwhelming.
Absolutely. So allowing us to make the phone call and find out, do they need to email you? Do they need to call you? Do they need to make an appointment to see you? It helps take the burden off of them.
That's great. And how many folks have you served so far with this? I mean, approximately, I know.
Well, we're also going to COVID test sites and handing out mental health information. So we're over about 1,100 so far.
Wow. That's a great number. And are there more of these grants that are around the state as well?
Yes, there were several that were awarded in Missouri. I would like to say that we're fortunate enough in our service area. Every county that we actually have another provider that received the same grant. So we're actually doubling down in our counties. So if we somehow miss someone, there is another provider that's there to kind of help us because we have a lot of people to reach. We're reaching out to nursing homes, to first responders, to healthcare, to school, to the parents, to the students. It's a lot. So with us having so many providers that are a part of this network, it really is nice. And we have weekly meetings with each other so that we know kind of what everyone is working on and we can really integrate and kind of become one unit.
Wow, that's great. You guys have built a true network of helping people out. What are some of the major needs that you're seeing right now?
Mental health. Everyone's overwhelmed, they're stressed, and there's new anxiety. People that have never dealt with anxiety before in their life. are now feeling anxious about things, whether it's the upcoming holidays, going to the grocery store, the toilet paper shortage that's happening again.
Right.
These are all things that we didn't need those coping skills before this year. So being able to talk to someone in kind of a safe place, we don't pass judgment, we don't shame anyone, because mental health is so important. And it gives them someone besides their family that they've been talking to a lot for the past year to really be a soundboard, and for us to say, here's some resources, and here is some information about self-help. Here's some information about some coping strategies that might work for you. And, if they don't, reach back out to us and we'll get you even more information.
That's great. Can you talk a little bit about those coping strategies? That really hit a chord with me, because I totally agree. These are things that we've never had to deal with before or cope with before. So what are some things that you're suggesting or teaching some of your clients that come through?
Do you mind if I grab a flyer real quick?
No, that's fine.
Okay. So we have been handing out some different things at the COVID test sites, but I have one that I shouldn't have favorites, but it's my favorite. And it's 12 simple habits to relieve stress. So we go through, go on a digital smartphone detox, because sometimes we are connected to the wrong things. Read a new book, engage in a creative activity. So it says eat foods that reduce stress, but we got to be careful with that. We got to keep our nutrition in check.
Mm-hmm.
But it mentions avocados, lemons, dark chocolate, oatmeal, and almonds. They help us to naturally reduce stress. Move your body each day, even if it's just 5 minutes. Just get the heart rate up a little bit. It helps release, endorphins. Make sure that you're getting enough sleep. Focus on your senses. So do some grounding.
Mm-hmm.
Spend time outside. I'm lucky enough, I live in the country, so I have plenty of open space without interacting with another soul.
Right.
Your personal hygiene, taking a bath, taking a shower, dance like no one is watching. Mm-hmm. Just feel good for a minute, even if it's in your kitchen. I taught my teenage boys how to two-step during quarantine. It was a good time. Laughing. And the last one, pet your pet. If you don't have a pet, it's okay, but just enjoying the little things in life and really being able to focus on the good that we have.
Right. And going into the winter months is concerning, I know, for so many folks who are in mental health, because not only do we have the pandemic that we're dealing with, but now we kind of get some of that seasonal weather coming in, and folks kind of get down about that. So I think those strategies are so, so important. I know my kiddos were in quarantine, like probably every other person's kiddos. And I was like, get outside. You've got to go let the sun hit your face. And they were like, oh, Mom,
absolutely.
I'm like, yes, you can go outside. You can social distance outside. You're good. So those are great tips. And one of the things that I want to make sure is we give folks the website so they can get some more information.
They can go to pfh.org if they would like information from Preferred, but there is also a moshowmehope.org. And let me make sure that I actually, moshowmehope.org. I did it correctly. I feel better about that now.
Typing it in the chat box. Hope.org. Is that correct? Mo, show me. Oh, I forgot me. Goodness. Oh. See, I knew this was going to happen during one of my interviews, and it did. So with that, we will take that as a sign to sign off. Thank you so much for joining me. I apologize, everyone. This is the world we live in now.
It's all right. Pet your pet. It's
exactly.
Okay.
She needs a hug. Thank you again, Marylue. I appreciate it.
Yep. Have a great day, Alicia.
You too.